If you're dealing with deep shoulder pain, some catching and clicking, you may be dealing with a labrum tear. Hi, I am Dr. Sebastian from Integrative Rehab Medicine.
My name's Floyd. I'm the PA working here.
Today we're going to talk about labrum tears. So Floyd, what is the labrum and what is a tear in your labrum?
So in your shoulder, it's a ball and socket joint. So you have the ball and then you have the socket. On the inside of the socket, there's this cup made of connective tissue that the ball sits into and helps hold it into place. And depending on types of injuries, you can get a tear in that cup.
So that cup is the labrum. It's like a fibrous or fibrocartilage tissue that helps to create a deeper joint. And that allows for the joint to be a little bit more stable. So unfortunately, people with certain injuries can injure that joint and it can cause a tear. So what are some of the types of tears so what are some of the labrum tears?
The most common type of labral tear is going to be a slap tear. That's where the cup has actually gotten torn. Another thing that can happen is people can have degenerative labral tears. So we see that very often here in Florida where people are dealing with more arthritis, where the ball and socket joint has lost that space and that degenerative process has broken down that labrum. So that's what I see most often here in the office.
And not all labral tears cause pain. Very often patients have on their MRI findings that there is a labral tear, but that doesn't always mean that there is pain coming from the labrum, but sometimes it is. So what are some of the symptoms of a labral tear?
People are going to feel a catching or a locking sensation, like they just can't move their shoulder through it. It can also be a grinding type of sensation, especially when it's more degenerative in nature. You can lose range of motion. You can feel pain, especially with certain movements. You can get a sharp, quick pain that kind of goes away after you wiggle your shoulder out of the way.
The other thing that I see with patients is there's a feeling of instability. Since that labrum is that fibrocartilage that stabilizes the joint, if there's tears or injuries, patients can have actually feeling of instability and popping out with the shoulder. So the number one thing to do is to get a good diagnosis, and we start off with a good physical exam, then we can do some scanning like an ultrasound or an MRI, and that can identify labrum tears. And once these are identified, there are non-surgical treatments like regenerative medicine treatments. So what are some of the ways we can treat any of these labrum tears?
The most common ways that we're going to be treating these labral tears are with either PRP or stem cells. So PRP is platelet-rich plasma. So we take your blood and we have a lab and we process it and we use that for the injections. PRP works good for smaller tears. It also works good when people have more mild to moderate arthritis that we find on the imaging. When people have more severe degenerative changes or there's larger tears and piece of cartilage missing, then we end up using stem cells. We use bone marrow stem cells, so we could take the bone marrow and again process it in the lab and then use that directly into the injections under image guidance.
So the nice thing about using regenerative medicine, we can actually help the body or stimulate the body to try to heal some of this. These are not perfect treatments. Not all labral tears are going to heal completely, but with a good treatment, with regenerative medicine and some physical therapy, very often these labrums can become stronger, healthier, and improve in their function. So if you want to find out more about labrum tears and any of the regenerative medicine treatments that we mentioned, just scroll through our website and you can contact our clinic to find out more.